Okay. Good morning, everyone, and welcome to our Innovation Breakfast, the Reinvention of Food. I'm Eileen Ellsworth, the President and CEO of the Community Foundation for Northern Virginia. And today we discuss the reinvention of the emergency food safety net in real time, no less. COVID-19 has caused the closures of nutritional support sites like schools. It's caused cutbacks on public transit systems people use to access emergency food. It's caused fear around using those public transit systems during the pandemic. And in the middle of it all, there are supply chain issues and record level demand. Today, our panel of prominent, talented local professionals are going to share with all of us how they are reimagining the food safety net to help make it more nutritious and more accessible to those who need it the most. So thank you all for joining us this morning. Before we begin our program, I'd like to thank our event sponsor, Wealthspire Advisors, for its wonderful sponsorship of this morning's program. And I'd like to introduce John Wolfe, the Managing Director of Wealthspire Advisors, former board member of the Community Foundation, to say a few words about Wealthspire and their commitment to today's topic. John?
Morning. Thank you, Eileen, and good morning. Happy fall, everybody. Again, my name is John Wolfe. Work out of the Reston, Virginia office here in Northern Virginia with our firm, Wealthspire Advisor. So who are we? We are an independent registered investment advisory firm. And what do? We help clients make good decisions about their financial lives. And that includes families, it includes individuals, it includes institutions, associations, endowments, etc. And at the end of the day, we love working, and I use the word partner with our clients. Partner is important because partner is a collaboration with our clients, and we collaborate sometimes on a daily, weekly, monthly, yearly basis with our clients. Decisions about their investments, decisions about their income tax planning, decisions about their estate and trust planning, anything. I often say we're the outbox for our clients, anything financial related. We do have a nice presence here. I mentioned Reston, one location. We also have a presence in Potomac, Maryland. So we cover the DMV fairly nicely. We are headquartered in New York and Manhattan with about 150 associates firm-wide. We mentioned families, individuals, and institutions. A lot of our clients are entrepreneurs. We work with generational wealth. We work with clients that are just getting their careers started. We have a very, very good educational program that we work with our clients and our clients' children in many cases. So I want to thank Eileen, Tara at the Community Foundation, special place in my heart. For the Community Foundation. And just one last important point. So we work with clients all over the world, actually. Most of our clients are here nationally, but when COVID hit, we really made a valiant attempt to give back. And it's in our DNA at the firm and with our associates. And we've worked with national organizations like Feeding America, to Jennifer Montgomery, one of the panelists here. We have a long-standing relationship here in Loudoun County and Loudoun Hunger. So it's wonderful to be with you all this morning, and thank you, and I'll turn it back over to Eileen.
Thank you, John. Thank you so much. So it is now my pleasure to introduce our keynote and panel moderator, Jennifer Owens, President and CEO of the Arlington Community Foundation. You know, Jennifer is a wonderful community colleague of mine who has been running the Arlington Community Foundation since October of 2018. And while her full bio is in the program, and I would direct you there, I would like to add this. The Arlington Community Foundation participated as a key community partner in something called the Collaborative for a Hunger-Free Arlington, which was an initiative that was launched by Arlington County in the very early days of COVID-19. So Jennifer had the opportunity to witness firsthand the barriers and struggles that people were experiencing to access emergency food. And as a result, she has some important insights to share with us today. Jennifer, welcome, and thank you so much for joining us. Jennifer, you're on mute. There you go.
That's right. Thanks, Eileen. I'm exceptionally grateful to my community foundation colleagues from around the region for welcoming me. It's been 2 years and I can hardly believe it's been that long already. Eileen and I have had the good fortune of having regular calls together with our counterparts in other parts of this region to share ideas and ensure that we aren't unnecessarily duplicating effort, which is really important, especially now, and working collaboratively on solutions that are promising, but that are bigger than all of us. Eileen and the Community Foundation for Northern Virginia are and will continue to be a vital part of any collective success we achieve in the DC region, and I'm just grateful for the partnership. I'm an optimist by nature, and I believe that there's no issue that we can't solve if we work together. Some issues are more complex than others for sure, but I have always thought that the provision of basic needs like food and shelter to be among the challenges that we already know how to solve if we can just all pull in the same direction and push enough resources toward the places where solutions are working. This pandemic crisis has tested this belief, and unfortunately at times my optimism in general. But we know that we have to keep moving forward, and that's why things like this Innovation Breakfast series are so important. The answers aren't always going to come from doing what we've always done, but doing it bigger and faster. We're going to have to be creative. We know that this pandemic has pushed an additional 48 to 60% increase in food insecurity in our region, and those numbers can be very daunting and challenge any optimist. At the start of the crisis, I thought that food would be the easiest issue to solve. We've been working on this issue for a long time, and we had a strong network of public and private partners. I thought that we'd be able to quickly and efficiently scale up our efforts as long as we had enough money to do so. I guess in philanthropy, we always think if there's enough money, we can do it. But we've all soon noticed that the food security box is not going to be an easy one to check, as we thought it might be, because it wasn't just about having enough money. Our nonprofit food distribution system is founded on the principle that people in our community need supplemental food sources to ensure the health and well-being of their families during hard times. And I put an emphasis on the word supplemental. It takes for granted that transportation and food supply are in good working order, and it doesn't contemplate that every interaction with another person will be a potentially hazardous to your health and maybe even your life. And going from supplemental to primary service of food is just the start of the complicating factors. As our panelists will talk about in a few minutes through the questions that we're going to go through, I wanted to just highlight a few of the things, and Eileen alluded to them here at the beginning. For many people, this may be the first time they've had to engage with the safety net system. Record job losses, especially in the lowest wage positions in food service and hospitality, have pushed thousands in our region to the brink of disaster, and they may have previously not had to take advantage of the nonprofit safety net. I think those of us who have had limited experience with the social safety net from the client perspective can have a difficult time understanding what it takes to learn to navigate that system. We also have a number of excluded people in our community. Our undocumented and immigrant neighbors face barriers to even the traditional benefits available to many citizens during this crisis. Extra unemployment benefits, stimulus payments, and a number of other government relief programs are inaccessible to many who need it. Fear of being labeled as a public charge has made many afraid to even access non-governmental assistance. Then there's transportation issues. Public transportation was disrupted and deemed less safe, creating barriers to getting to particular food distribution sites and transporting the food home. Just the weight of the food. I think if you would think about your grocery store visits and what it would take to carry every single thing that you purchased for an entire week home on public transportation or by walking, you can put yourself in the shoes of a person who's dealing with these types of transportation issues. There are childcare issues. It's more difficult for households with children to get to distribution sites, especially if they're required to bring their children with them to receive school distributions, as was the case in the early days of the pandemic. Without school, their children children also relied on the family to provide more meals each week. We in Arlington were able to quickly identify the issue of having to bring your children to school sites as a barrier and work to solve those. And I think that's the type of innovation that we're looking for. There are health concerns. Residents in need may be at a greater risk for catastrophic health incomes if they're exposed to COVID-19, making them less likely to attend any food distribution sites. Nonprofits and other food distributors also face concerns about exposing volunteers and staff, and I know our panelists today probably wake up every day thinking about the staff and volunteers that work in their organizations and the risk that they're putting themselves at. We also have food supply chain issues, of course. There's been difficulty in getting food for all of us and lesser donations because of it. So we can't really underestimate or overestimate the amount of issues that the food supply chain has caused to this effort. Distribution partners have collapsed. So many of the smaller nonprofits that we rely on in the food distribution to move food out to the people who need it the most were often experiencing their own issues with either volunteers or their own sustainability. Distribution complications have abounded. All of this compounds to create significant challenges to get through to our traditional nonprofit food security partners. They need more space, more protections for staff and volunteers, and they have smaller numbers of both. Pre-boxing everything when they used to have a choice is also a different thing for the people who need food in our community. And then there is a whole piece of this that I think we as a community often put kind of last. We think about these things last. The idea that people would have the choice of what food their family eats, have the dignity of how they receive that food, and then being sensitive to any dietary restrictions or cultural sensitivities that need to be taken into account in a household's weekly food. So the one size fits all doesn't really work anytime, but especially in a pandemic. We've often thought, I think, of food security as there's a number of people that need food, there's food, and if we could match them up, that everything would be okay. But I think we know now that that is a very simplistic way to look at this. It can feel very overwhelming, but fortunately for us, there are people who get up every day bound and determined to address each and every one of these complicating factors. And they're doing it with pure grit and resolve, but also with creativity and a willingness to throw out old assumptions and look at things through an equity lens. I think we have if Tara, if you want to go to the next slide, we have sort of the big question there. We'll go forward one more. So you can see on this slide the number of people that we're expecting to be increasing the number of people who are food insecure in our community by community. And there's not one single community in our region that's been unaffected by this. Move forward one more. Oh, I thought there was one more slide. So there's, oh, there we go. So how can we identify, tackle, and address these issues so that we're clearly moving on a path forward that works for everyone? There was a great summary at the conclusion of the hunger report that the Capital Area Food Bank issued a challenge. Persistently unequal access to resources and opportunities has long characterized our region. In the pandemic's harsh spotlight, the factors contributing to our area's rates of food insecurity are more pronounced than ever. This visibility presents a unique opportunity to address them and to include and empower our most vulnerable neighbors as we rebuild. And that is really the commitment that each of our panelists here today have made, is to really include and empower our most vulnerable neighbors. But they've also really brought that spirit of inclusion and a willingness to be creative. So now I'd like to introduce our panelists for today. We are joined by Julie Buisson. She is the Business Operation Manager for Spring Forward of the PHILLIPS programs. We have Dawn Hyman. She's the Project Manager for One Fairfax, Office of the County Executive for Fairfax County. We are also, it is our pleasure to have Ondrea McIntyre-Hall, Director of Health Access and Nutrition Services for our friend Northern Virginia Family Service, and Jennifer Montgomery, Executive Director of the Loudoun Hunger Relief, as well as Radha, Muthiah, President and CEO of the Capital Area Food Bank. And their full bios are in the program if you'd like to read more about these amazing women. So now I'd like to begin our panel discussion with some of the questions for each of our participants. There'll be 10 minutes reserved at the end of the program where we'll take questions submitted by any of you. Please type your questions in the chat box, as Tara mentioned at the beginning, and we'll do our best to address those at the end. So I'd like to start with a question for Radha. Can you describe and define the food distribution system? What's the difference between a food bank and a food pantry, and just kind of help us set the groundwork for what food distribution looks like in our community?
Great. Thank you, Jennifer. And thank you, Eileen and the Community Foundation for having me at this breakfast today. A few things. So just to set the context, as you've done so well, Jennifer, our region pre-COVID had about 400,000 food insecure individuals across the greater Washington region. And as Jennifer just highlighted, the report that we released this summer projects that this is going up, and in fact has gone up to slightly over 600,000 individuals. And this has happened in a very, very short time frame. We've seen the last 5 years of reducing rates of food insecurity, but that has all been reversed, if you will, and accelerated in absolutely the wrong direction. So that is the change that we are having to address, if you will, over the short period of time. And from additional research and analysis that we're doing now, looking out for the next 5 years, the impacts of the economic downturn are likely to last us for many years. We're starting to look at what recovery and rebuilding will look like, and it's clear that we're in this for quite some time to come. So in terms of how the food distribution network and system has been set up, you know, we operate as a food bank. We're the food bank, if you will, for the greater Washington area. I know earlier, you know, John mentioned their support for Feeding America, and thank you for that. Feeding America support, you know, is an association of about 200 food banks, each of which has its own service region. And so the Capital Area Food Bank has Northern Virginia, all of the district, Prince George's, and Montgomery County as its service region. We typically operate with about 450 different partners. They could be faith-based institutions, small community NGOs, large ones like Food for Others, you know, in Virginia, as well as Martha's Table, Bread for the City, Manna, some of the names that you all are fairly familiar with, but hundreds of very small ones. And to Jennifer's point, right at the beginning of the pandemic, literally in the first 2 weeks, we saw our partner base go from 450 to 50, where so many had to close their doors because of fear, uncertainty, lack of volunteers, and all kinds of other issues as well. So we have now we're operating with about half the partner network, and those partners are really the food pantries that you're more familiar with. So specifically to Jennifer's question, a food bank, you know, brings in a tremendous amount of food resources, whether that's donated food from retailers, food that we purchase, food from the USDA, and then we supply it through this network that then goes on to supply it to end clients. I'll just close this portion by saying that there's been some incredible shifts in how we've had to operate over the last 6 months. One, in the, you know, pre-COVID, we would get 2/3 of the food that comes into our network donated to us from retailers, wholesalers, big food drives, et cetera. That dropped 75% within 2 weeks of the pandemic hitting. And we all experienced that because we were going to the store, you know, and cleaning out the shelves, basically. So there was nothing left. That has been consistent for the last 6 months. So we have had to pivot, and we are now purchasing 2/3 of the food that we provide. The other thing that's changed is we have hosted many pop-ups. We've brought in what we're calling temporary partners. These are organizations who've never distributed food, but understand the need that exists right in their neighborhoods. They may have provided other basic support services, just not food. For these organizations, it's been terrific that they want to provide food, but they don't have the storage capacity, the cooler and refrigeration, or necessarily the safety abilities and standards to be able to keep food. So what that's meant is we've had to box food, whether that's produce or shelf-stable items, and deliver just in time for them to be able to make their distributions to end clients. So it's a whole different operating model that we have had to pivot to. And the last thing I'll say is that we're still maintaining what we call a wellness index and a culturally relevant index. In our region, these are very important. I mean, wellness index should be important in any region in the country. That is to ensure that we're providing healthy, nutritious food. And our wellness index hovers around 84% of all the food that we provide is either fresh produce, low sugar, low sodium, high fiber. And then a culturally relevant index, particularly important here and particularly important in Northern Virginia, given the number of immigrants and families there. So I'll stop with that and happy to jump in later.
Yeah, that's a great overview of the kind of the macro system. I wonder if we could hear from Jennifer Montgomery about at the Loudoun County level, how have you increased, how has the increased need really impacted you and changed the distribution model that you have there in Loudoun County?
So just like the rest of my colleagues, we've all seen a significant increase in need as well. And I think a lot of the traditional ways that we were providing food and getting food out into the community just weren't really viable with all the guidelines and the things that we had to do. So, you know, we immediately, excuse me, like everyone else, thought, how do we quickly and safely get a volume of food into the community? So for us, we had a choice pantry where people could come in and they could shop for themselves and they could make choices. And we also agree that wellness is important and having access to healthy and nutritious food is really important, but that just wasn't possible in the small space that we have. And so we pivoted very quickly to an all appointment schedule. And we, over a weekend, brought up an online appointment system. We were taking only phone calls for appointments, and we were quickly overwhelmed. Our staff was getting nothing else done but answering 600 phone calls a week of people trying to make appointments. So we were able to pivot quickly, have an online appointment system. But we also realized that that doesn't work for everybody. In the same vein that a lot of our children don't have connectivity for schools and people don't have access to the internet. They don't have the ability to do that. So that didn't work for everyone. And so we also still are accepting phone calls to make appointments. And we're also now taking our food into neighborhoods and into communities where we know that there is need, and we're not making people make appointments. We're showing up at a designated time. In fact, this morning we'll be in Eastern Loudoun. We have been consistently serving 200 plus families on Thursday mornings, and it's just a walk-up site. So very similarly, I think to everyone else, we've had to just completely rethink our purchasing. We never really did a ton of purchasing. Now we're doing a ton of purchasing. It's been, you know, the same as was described.
And you've had different organizations, just like Radha mentioned, you know, as the distribution system needed to be bulked up with new partners. You've worked with some different entities as well in Loudoun. Can you talk a little bit about the different partnerships that you've had to develop to be innovative in that way?
Sure. So one of the things that happened quickly and I'm really proud of in our community was that we got together as a human service network and as a human service agencies with our county partners, with our school partners, and we had conversations quickly about how do we help and how can we help each other. And one of the things that Loudoun County Public Schools did was quickly start putting school food on buses and taking it into neighborhoods in Loudoun. And so we said, well, can we put some of our shelf-stable bags of food on those buses? And they said, absolutely. So our schools have been picking up from us every week, and they take those bags of food into the neighborhoods. They take them out on the school buses with them. And so that's been a great way. I think we've distributed about 120,000 pounds of food that way, getting that through a trusted source. The schools are a trusted source for many families. We've also partnered with our community health center. They are certainly HealthWorks of Northern Virginia. They're certainly seeing a lot of patients and a lot of people who need assistance. And so we have stocked a pantry there pre-COVID. We've bulked it up since then, and people have the ability to get food that way too. And then we also act as a produce hub in our community. And so we've had some new and different partners, again, as Radha said, that have never distributed before. And now they're able to help get food into places that we may not be able to. So we knew that we couldn't do it all and be all things to all people. And so collaboration and partnership, I think, is really, really key right now, and also working into the future.
Yeah, I think one of the partners that's really stepped up has been the Northern Virginia Family Service. I'd like to ask Ondrea to talk just a little bit about the innovative model around staffing and volunteers to support the increased food distribution needs that you've seen through NVFS.
Absolutely. Thank you. I appreciate being here this morning with all these wonderful colleagues.
Glad to see you.
So, you know, we have an 8,000 square foot food distribution center at our Serve campus. And we have hundreds of volunteers. And I think we can all speak to the fact that a lot of our volunteers also fell into that vulnerable category of being older citizens. And so, as we were finding out that COVID was disproportionately affecting, you know, elderly folks, all of our volunteers were like, see ya, you know, we want to live. And so that really created a significant challenge, because we knew we were also going to have an onslaught of new folks that needed to show up at the center. So we really took a look at our structure to determine how could we create some real natural physical barriers so that it protected volunteers, staff, and clients. So we shifted our actual facilities to be able to manage that. And as a way to protect our clients and our staff and our volunteers, we gave a larger distribution of food to families who came to the pantry. So even with the supply chain issues, we wanted to weigh supply chain over safety. And so we ensured and continue to ensure that families get a full 2 weeks of supplement. And that is 3 meals and 2 snacks for everybody in that household. So it could equate to hundreds of pounds of food for folks. So when you speak about transportation, it is impossible to, you know, use public transportation or sometimes even an Uber to move that kind of food. And families really appreciated that, because it also cut down on the number of times that they would have to come back for emergency bags to continue to supplement themselves. And us too, like Jennifer, one of the things that we did is we pivoted to a phone system for our intakes and our registrations and our appointments, and ensured that we had dual language capability for that as well. Because we no longer had volunteers who were, you know, willing to come in and, you know, do those appointments. The other thing that we did was we partnered with an organization called, I have to say this very slowly, Get Shift Done. And essentially, they were an organization that popped up and wanted to really be able to help displaced workers because of COVID. And so folks could actually sign up for slots to work at our Hunger Resource Center and still be compensated for that time. And so it was a win-win for folks who still needed to have access to income, as well as helping us manage all of the things that needed to be done at the warehouse.
Yeah, that was a really innovative, the Get Shift Done was a very innovative way to also help people by providing jobs. So that I'm glad you pointed that out.
Yes. And, you know, I just wanted to say, just added this note, you know, COVID has really laid bare how we define who is vulnerable. And one of the things that we really wanted to recognize is how do we pivot our intake process, because you can live in a $800,000, $900,000 house, and if 2 parents have lost their income, who we traditionally thought was vulnerable is not just low income folks who may be, you know, challenged and living on the margins. It's anybody. And so from an equity proposition, we really changed how we looked at and the information that we collected for people for our intake process, recognizing that anybody could be vulnerable at this time. And we didn't want to create a superficial barrier and allowing people to get access to be able to feed themselves and their families.
Yeah, that's a great opportunity to pivot to the work that One Fairfax. Dawn, if you could talk a little bit about the Fairfax County government's work to address systemic racism in the food distribution system. You know, Ondrea mentioned that new people are being, thrust into need. But there's also kind of a systemic underlying issue that has always presented challenges, and Fairfax County is really trying to address that. Can you speak to that a little bit?
Absolutely, Jennifer, and thank you all for allowing me to be a part of this very important conversation and to be amongst such passionate and powerful women doing such great work in our food system. I really appreciate this question because I think it's important to acknowledge two fundamental aspects of our food system, and one being that systemic racism is deeply rooted and pervasive in our food system, and two, that our food system, like many other societal systems, isn't broken. It's working exactly the way it was designed by those who designed it. And so while our food system continues to work for many, barriers and inequities still exist for many others through race, socially, economically, particularly in our marginalized and communities of color. And so the county has been working to address systemic racism in the food system in a very intentional and systematic way. First, through the adoption of One Fairfax, which is a joint racial and social equity policy to ensure that we consider equity in our planning, programming, implementation, and decision-making efforts. This policy has 17 focus areas to promote equity, one of which is a vibrant food system where healthy, accessible, and affordable food is valued as a basic human necessity. From that, as a result of One Fairfax, the Fairfax Food Council and Faith Communities in Action hosted a food equity summit last May to begin re-examining the food system through a racial and social equity lens, understanding the importance of how race, structural racism, power, and privilege play in our food system, as well as learning about food justice, food sovereignty, and food apartheid. And it also afforded an opportunity to explore a more intentional, expanded, and collective definition of food access that encompasses 5 different dimensions and includes the perception, knowledge, and understanding of what food access means to the community. I think it's important that the community's voice be a part of this process and a part of this system. And then from the Food Equity Summit, created opportunities for the county to build the capacity of food system stakeholders across various sectors to begin addressing systemic racism in program and service delivery, the inventory of food and other items, the intake process, board selection, donor education around impactful and more intentional donations, and ensuring that the community's voice is heard and elevated so they are getting what they need where they are. And addressing systemic racism in our food system is a journey that involves a shift and a mindset. So this work is ongoing and continuous.
Yeah, we can't and shouldn't go back to the way it was before. When we talk about a post-COVID community, it's not getting, it's using this as an opportunity, I think, like you mentioned, to really build it better and build it back. So it's, your quote, it's working exactly as designed for those who designed it is a really important point, I think, for all of us to realize, because it means we have to go back down to that fundamental question and make sure we're answering, and fixing the right problem, not just the one that appears to be at the fore. I want to bring Julie into this conversation because when we think about how we're going to rebuild differently and do things in an innovative way, I'd like her to talk a little bit about the PHILLIPS programs and in particular the hydroponic farming and social enterprise program, because this is a great example of some of the ways that we're going to address this in new and creative ways.
Hi, yeah, thank you, Jennifer. And thanks again for having me on this panel. It's an honor. So SpringForward is a commercial indoor hydroponic farm that is being developed as one of 3 PHILLIPS program social enterprise initiatives. So what the primary goal of SpringForward is to increase workforce development opportunities for people who traditionally encounter barriers to employment, and to do so in growing industries such as indoor farming, whose value skyrocketed during the pandemic with a surge in demand and whose market size is expected to reach over 160 billion in the next 5 years. So the inspiration for Spring Forward really grew out of one of our career tech and education programs called Growing Futures, which has been operating out of the Laurel campus for the last 5 years. Growing Futures exposed our students to the entirety of the food production process from seed to plate by combining indoor vertical farming and a culinary arts kitchen. And by putting the two together, we saw really wonderful things happen. Actually, if you attended last fall's Community Foundation dinner, you might have seen a little bit of that. If you remember, you had in front of your plate an edible lollipop, a lollipop made with edible flowers. Well, our students not only grew the flowers, they also dried and pressed them, made the lollipops from scratch, and packaged all 300 orders. And so this kind of real world application of lessons taught in the classroom also led our students to be able to learn about entrepreneurship. So for example, last year we started selling a portion of our produce to some of the restaurants in the area, one of which was Spot and Sonnen, which was named one of the top 50 best new restaurants in America by Bon Appetit magazine. But now in the wake of COVID, we started exploring different and unique alternatives for models of distribution. One of those things is that we started discussions with a team of researchers from the Hopkins University School of Public Health to assess how we can provide high quality, culturally appropriate fresh produce to corner stores. And so our hope with that is to promote the resiliency of food production and food distribution in cities. So out of the success of this program, Growing Futures, we did realize two things. First, that there was an incredible impact that growing food could have on our students. A lot of our students found working in the farm extremely soothing, and they also became much more willing to try out a variety of fresh produce that they had not been exposed to before by growing and cooking with it. So, you know, some of our students started coming in asking for really obscure herbs, such as borage that they wanted to make lemonade with, or lemon sorrel, things of that nature. But we also discovered that there was a market out there looking to be served and willing to support our mission. So as a result, we saw great opportunity in indoor farming as an avenue to develop social enterprise, and so Spring Forward was created. And Spring Forward really, as a social enterprise, has a triple bottom line. First, it will follow an employee ownership model for people who lack opportunities for livable wages and who often don't have a voice in the workplace. Secondly, it will increase production and access of fresh, healthy foods that are culturally appropriate in urban food priority areas. And thirdly, it will address a lack of land resource by growing in underused urban areas using sustainable growing methods to ensure high quality, high safe food with a minimal environmental impact.
That's great. I can attest to the fact that when kids are engaged in the process, they are really willing to try new things. And just as we all have to be during this crazy time. I'd like to go back to Ondrea for a minute and just talk, because we've now talked about some of the really creative things in food security, but as we're solving the food insecurity issue, we're also engaging with people in new ways, and that might present opportunities then to provide additional supports to people while we're already delivering this other, critical service that's bringing people out. Can you talk a little bit about NVFS's work in that?
Absolutely. So as I mentioned before, when we thought about safety and security around accessing food, one of the things that we did, we established a partnership with ACTS in Prince William County. They have a program called the Food Rescue Program. We didn't have bandwidth or capacity to be able to do what I'm getting ready to mention. And so each community, I think, really rallied around what assets were available and how could you effectively collaborate to be able to serve people more or better. And so they have a program that folks volunteer through this app to make deliveries. So all of our seniors who were 65 and older, we were able to shift them to a food delivery model. And so they get their delivery every month, every 30 days, they get their 2-week proportion of household supplies and groceries. And so that has been a really effective partnership. Actually, I turned in the 23rd week list just this week. So we've been doing that for 23 weeks. The other thing that we have done is we've really championed our expertise in being able to ask people more questions related to what they're experiencing. So not just about food, but tell me a little more what's going on, and let's help you be directed to the other resources that you need as well. And so most of our staff are trained up on the ability to ask those additional questions. And because MVFS we got funding to do so much more in terms of information and referral and getting financial assistance out to folks. When people would call our hunger resource line, we would ask those questions. What are the other things that you're struggling with or you're being challenged with? And we would make those direct referrals to either internal programs that we had, or we would refer them to other community agencies who we knew were doing that work. The other thing that we did as well is when we would have a conversation with folks about how to use what were their liquid assets that were coming in, because shelter was one of the primary things that we wanted people to make sure that they maintained. We would say, let's have a conversation about your finances. If you get this resource from the Hunger Resource Center, then that means you can save those dollars to be able to pay for your mortgage or your rent or your car so that you can maintain your transportation. So most food banks likely aren't asking those kinds of questions, but we wanted to kind of fall back on some of that expertise and create that bandwidth for us to be able to ask some of those questions to help folks deal with some of the other things that were posing as challenges for them as well.
Yeah, I think, Fairfax County has also been doing some innovative work in this. Don, I wonder if, following on what Ondrea was just talking about, you could talk about the partnerships with business and nonprofits that you all have developed in Fairfax to address current needs. Oh, you're muted. There you go.
I'm sorry about that. So as we know, and as we've been discussing this morning, food insecurity is an issue. It has been an issue and continues to be an issue. And the county has been working with nonprofits and the faith community for quite some time to address food insecurity. And unfortunately, our current food system has not evolved to meet the cultural, ethnic, and religious demands of a growing, diverse population in Fairfax County. And so then if you overlay this with a pandemic, which has exacerbated the inequities around food insecurity and access, and as we mentioned earlier, more people now are food insecure who weren't previously, as well as small businesses who are facing economic hardships as a result. And so to address these issues, we came up with a solution by way of a pilot program called the Coalition for Equitable Food Access and Economic Relief. And through this pilot, we've been able to serve over 300 families in several areas of the county with prepared meals and grocery items that are reflective of their culture or religion. And the success of this pilot is based on many important factors. First, a partnership between nonprofits, small businesses, and government. And for this pilot, the nonprofits were Facets and ICNA Relief. They recognized how this issue impacts the communities that they serve, and they understand the importance of partnerships in trying to address communal issues. Also, for small businesses, we partnered with Frontier Kitchen, and their role has been extremely beneficial in leveraging resources and connections, particularly the food vendors who have prepared the meals and coordinated the grocery bags that have been distributed to these families. And then, of course, government. Second, the funding for this pilot came from our Human Services Council's Innovation Fund, which provided an opportunity to test out an innovative approach to address food insecurity and access. I think it's also important to note that this pilot is not a one-off effort, and that we are working to sustain this program as a continued approach to really transform our food system. Frontier Kitchen is currently looking at ways to replicate and adapt this program in Montgomery County once they get settled in their new facility. And we're also connecting nonprofits that have participated in this pilot to food suppliers so that they have additional resource of obtaining foods and other items that are reflective of culture, religion, age, and health.
Yeah, I think that's, what we were talking about at the start of this. When you look at all of these barriers that people have, if we could think of them not as barriers as much as items that need to be integrated in the new solutions that we're going to have going forward, that's that innovative spirit that takes that negative thing that seems like just one more complicating factor and says, this is part of the strength of our region. We need to embrace it and really address it and incorporate it into what we're doing going forward. So thanks for sharing what you're doing there in Fairfax. Radha, I'd like to go back to you for just a second. We're going to go to some questions from our attendees today, so feel free to put those in the Q&A while we're answering a couple more questions before we move on to those that you all in the audience today have. But Radha, can you talk a little bit about how you've had to innovate and what really are some of the ways that you think all sectors of our community can innovate moving forward to address this insecurity in our region? I mean, I think we've got a lot to fix, but what are you seeing?
I think, similar to what others have said here, a family or an individual who is food insecure is not just food insecure. Generally, they are in need of other basic support services as well. So whether that's education, healthcare, skill development, shelter, the list goes on. So what we're seeing here is if we want to recover and recover in a much stronger way that actually takes into account all these fault lines that have been exposed over the course of COVID and starts to address them much more holistically, we have to be able to do it in a much more integrated manner. So a few sort of innovative approaches I think that we and others have taken and that we can continue to take as we go forward. One is there are too many parts of our region that are low access areas, or food deserts is a term that's used as well. These happen to be in areas of low income. These happen to be in areas with very high minority populations. These happen to be in areas with a high level of Title I schools. The list goes on. And they also happen to be areas that haven't been served in decades. So we've spoken about them for decades, but we haven't really taken an investment that is an integrative one. So for food access, there's several innovations that are happening now. Alternative format grocery stores, many social enterprises that are coming up to be able to address them. We at the Food Bank have something called Curbside Groceries, which is the grocery store that comes to you, that's operating in the Anacostia area, now in Prince George's County, and we've had a request to take it to Northern Virginia as well. So those are just some ways in which we can address these. Many of us, I believe, have many partnerships with rideshare providers, excellent ways of being able to get people to full service grocery stores so that they are able to have a true choice of whether they want to buy culturally appropriate food, healthy food, and not just count on what they can walk to, which is often more the convenience and fast food options, which are not healthy or nutritious, or neither are they desired, by those families. They just happen to be accessible. I think many of the other issues that we can do in terms of an integrative spirit in addressing and providing more of a one-stop shop is to bundle all of these support services as much as possible. And so that's what we have started to do. It's a Food Plus program, and it is bundling food with healthcare. So an example there is many in our area who are pregnant don't get prenatal services. There are many reasons why they can't access them: transportation, lack of health insurance, etc. But what we're doing now is saying, if you go to the free clinics that are available for your prenatal care, you can leave with several bags of groceries that have food that is appropriate for a woman, who is pregnant, to be able to have a safe and healthy pregnancy as well as delivery. We're setting up food pharmacies in different hospitals in conversations with Children's and others to be able to have doctors and nurses be able to screen for food insecurity with a simple 2 questions and be able to point them to a food pharmacy that is right in the building. They can go and get healthy, nutritious food before they leave. So again, a one-stop shop so they don't have to go to 3 different locations to get that healthcare, to get the healthy food and to be able to head back. The last thing I'll say is, as our region recovers, it cannot recover for just that top 20% that has 90+% of the wealth in our area. It has to be inclusive in its recovery. And the ways in which we do that are by supporting skill development for those who in the past have been left behind. And there are many ways that you can integrate food into that equation. So we've done it in several different areas, partnering with community colleges, partnering with skill development institutes. So every week someone stays in a skill development program, they get free groceries, and they're able to then graduate and go from a minimum wage intermittent job to hopefully a living wage job, one in which they're contributing to and benefiting from the economy. So there are lots of examples here of what we can do. We just need to prioritize those and focus on those. And that will take, the public agencies have a role in that. We as nonprofits have a role in that. And the private sector not only has a role, but stands to benefit significantly. We all know there's been so much growth in the private sector in this region, especially in Northern Virginia. We want that to continue, but companies won't come if there isn't a workforce that is skilled and ready. And when we look at this at the food bank, we say we're now supporting 600,000 individuals who could be a part of that workforce, but have been sidelined for one reason or another. So there is a benefit in public-private partnerships because it is a steady pipeline of human resource talent for companies in the future. And there is a real win-win solution if we work together.
Great. We have just a few minutes remaining, so please keep your questions coming if you have them. And Tara, if you can just set them in the chat for me as we move on. Whoever wants to answer this one, I'm aware that many of the people who are participating in today's webinar are the kind of people who have been giving generously probably to many of the efforts that you have spoken about today. How can donors really engage in helping support the innovation that you're trying so hard to make a part of our community going forward? And how does kind of philanthropy and the donor relationship with your organizations need to change over time?
I'm happy to start with that. And I think for philanthropy, there's several important roles that philanthropy can play. In this particular moment in time when we're all responding, and I've heard so many of us talk about pivoting our operating models, the support to enable that is critical. We're all purchasing so much more food than we ever have, and we certainly have in our history. Our budget this year for purchased food is 16.9 million. On an average year, it's 3 million. So you get the sense of the magnitude of increase. So certainly, financial resources are helpful and they're necessary at this point in time. As we look to recover and rebuild, I think, philanthropists who are also interested in playing a venture capital role to support some of the innovations that we've spoken about are very important. And philanthropists know, those who have supported the growth of businesses, it takes a few years to get something from a pre-pilot design stage to a pilot stage and then to be able to scale it up. The curbside groceries I mentioned, we're keeping a separate set of books for it because we do want to spin it off. We want social entrepreneurs to be able to look at that, think of it as an attractive proposition and set up these alternative format grocery stores in neighborhoods that don't have good choice. So philanthropists who are willing to blend financial instruments, that can serve as seed capital for nonprofits who are interested in testing out these ideas before they can be scaled is very, very important. And the last thing I'll say is many of our philanthropists are associated with companies, their own or larger entities. There are other assets that these companies have that can really help our operations. We, and I'm sure many of us here, are pivoting and providing much more food than we ever have. We're providing 50 million meals worth of groceries this year from 30 million meals. So the supply chain has to be that much more efficient. Our asset optimization has to be that much more efficient. Many philanthropists have access to those expertise that can be particularly helpful as we attempt to scale to levels that we haven't before.
Some of our questions from the community that's watching today, one is specifically about the role that schools have played in this meal delivery. So is it really sustainable for schools to continue to provide these universal for families to pick up, or do we need a new model? And I'm going to pair that with another question that was in the chat, which is, Is it, you know, for someone who actually, it's from someone who actually works in support of a neighborhood program to support students, worried about whether they should be shifting to provide gift cards to families so that they can have that choice that we've talked about being such an integral part, but we know that costs more than the amount, for example, that all of you would pay for groceries. So how sustainable is this model with schools, and should we be shifting more to gift cards? Anyone want to take that one?
I would jump in. It's interesting. We had a conversation about gift cards recently, and why I think it does allow folks the opportunity to have autonomy in deciding the food that is most appropriate for their families. I think the flip side of that challenge is accessibility. There's still a lot of folks, to Radha's point, that don't have grocery stores in their community. So sometimes getting that gift card to Giant or Safeway, if you have to take 2 or 3 buses or you have to pay somebody to get transportation, then it actually devalues the gift card as well. Oftentimes those grocery stores, the groceries are way more expensive. And so it reduces the amount of food that they can actually get as well. So I'm conflicted personally between the gift cards. I think you have to understand the community where those folks live to decide if that is a good choice for for those folks in that particular community.
Yeah, the need for individualization in this is one of the primary challenges, isn't it? You know, there's so many factors to include, but when we're trying to change something at a systemic level while also addressing people's individual needs, it can be really difficult to marry those two things together. Jennifer, did you want to add something to that? It looked like you were nodding along and had something to say.
No, I just agree that we have similar conversations about gift cards, and we get requests for them a lot, and so just exactly the same. And I want to hear what Radha thinks about schools and about food and that sort of thing. But my 2 cents for that is that it's that we need to strengthen SNAP, and that we need to strengthen the ability for people to be able to purchase their food. And I love that question about sustainability and about the charitable food system, because we are not equipped to feed everybody in the volume that needs to happen right now. And so I'll turn it over to someone who's more articulate than me about it.
Jennifer, you're absolutely right in that balance. You know, for every 1 meal that we as nonprofits provide, SNAP has the ability to provide 9. And so that gives you the sense of magnitude. So Jennifer's right, and we've all been advocating hard for the increases to SNAP, because that can have a much wider systemic and sustained effect, if you will, for so many who are here in our area. We're all supplementary nutrition providers, and we cannot possibly take over what the federal government can provide. The other issue of schools, I think that it's a very well articulated question with not an easy answer, because schools are a center point in every single neighborhood. So they play a very important role. And I think all of us would probably agree that they need to continue to play a role. The question is what type of role and how efficient can those, can that role be? So what we've seen in the last few months, unfortunately, with schools, moving to a virtual environment, is that there have been some challenges even in their distribution of the breakfast and lunch meal that they provide, and it's taken all of us by surprise in the last few months, and hopefully, things are a little bit smoother now. For us, we provide, in many cases, the after school meal, as well as groceries for the entire family at many of these school locations. So groceries for a month. So the meals are taken care of for the child, but for the rest of the family, we have a family markets program there. It was really challenging to figure out whether schools, which buildings we could use to continue to provide those. So there are lots of issues associated with that, but we do have just very good innovative ways that we're now thinking about going direct to home. Just as we all receive, Instacart or Amazon or anything like that, using those tools to be able to get directly to those who are low income is important as we go forward.
Well, unfortunately, we've reached our time. We're just getting warmed up here on innovation and the way we can really look at the food system differently with an equity lens and really deliver for our community in ways that we have never been asked to before and in ways that we know we'll need to do for a long time. So I really appreciate our panelists. I know we're going to hear now for a closing from the chairman of the board of the Community Foundation for Northern Virginia, Bernard Mustafa. And I just want to thank you for giving me the opportunity to moderate today and spend the morning with some innovative women doing some great work in this community.
Good morning, everyone. I'm Bernard Mustafa, Chairman of the Board of Community Foundation for Northern Virginia. I just want to take the moment to thank Jennifer Owens for moderating this discussion this morning, and thank our panelists for sharing your insights on this important topic. Extremely important, and I learned so much this morning, and thank you very much. And I'd like to thank Wealthspire advisors and my friend John Wolfe for sponsoring today's event. And finally, I'd like to thank all of you for joining us, and want you to be safe and well, and I'll see you at the next Community Foundation Innovation Breakfast. Have a wonderful day. Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you, Jennifer and panelists. You were fantastic.
It was wonderful.
Thanks, everyone. And there will be a recording available from today's event if you're still there and wondering, so we will share that afterwards. We're so grateful.
Thank
Thanks,
you.
everybody.
Bye-bye.
Thank you.
Thank you.
Appreciate it. Have a wonderful day.
Have a great day, everybody.
Take care.